Hey everyone, welcome to another episode of the Coaches Corner University podcast. I am your host, Paul O'Neid, and as usual, we are brought to you by Coaches Corner University. You can use code podcast300 to save $300 off of our education collective. That means $50 lifetime access to over 200 hours of continuing education lectures and growing, as well as discounts on all of our CEU accredited courses. We're also sponsored by TC Nutrition, Barefoot Shoes, and Bacon and Barbells. Today, I am joined by Dr. Lisa Lewis. I first heard about Dr. Lisa Lewis from my friend Jeb, who's been on the podcast a number of times, speaking to her prowess at addressing relationship with food. And that was something that I was very excited to talk about because it's a very front of mind topic these days. So Lisa, thank you for coming on.
Oh, thanks so much for having me.
It's my pleasure. So maybe give a little bit of a background into how did you get I'm going to assume that relationship with food and eating disorder behavior and that sort of avenue is it your specialty?
It's not my specialty, but it is certainly a part of something that I talk about and think about every week. So I am a psychotherapist by trade, and I've been doing that for over 20 years now. I started off as a master's level psychotherapist, and I started my work in addiction and inpatient psychiatry. So early in my career, I was working with people recovering from drug and alcohol addiction primarily. And after doing that for a number of years, I went back to school and earned a doctoral degree in counseling and sports psychology. That degree, part of it was focusing on working with athletes, performance enhancement, executive coaching. My dissertation research was on exercise motivation. So that's really one of my passions. What helps people develop an intrinsic desire to want to take care of their bodies over the course of their life. And
Very cool.
Yes. And so when I took me a long time to get through that program. I was working full time while I was doing that as a therapist. And then when I wrapped that up, I worked in college counseling centers for a while, which is a really fun population to work with. It's really getting to be a generalist and working with every kind of presentation I literally saw young people having their first psychotic episode. And then the next patient would be a freshman in college whose cat died and she just needed to talk to somebody. So really nice experience of working across the spectrum of mental health, which I loved. And eventually I opened my own private practice. I taught at a local university here in Boston called Northeastern University while I was growing my practice. And in that practice, I ended up seeing a lot of folks coming to me who had an athletic mindset, type A, high achieving kind of person, who was doing really well in life and by all appearances on the outside was perfect, but on the inside had something going on with an addiction. So my practice really was built on seeing a lot of men in finance or in law or in other kinds of high stakes professions where they wanted to talk to somebody who understood performance, but also who understood addiction. In the meantime, I was working with athletes also and working more and more in the fitness space because my husband is a strength and conditioning coach named Tony Gentilcore. So he has done a lot of continuing education.
I forgot that.
Yeah.
I forgot that Tony was your husband. Okay.
Yeah.
That makes a lot more sense now.
So he was traveling the world doing workshops and seminars everywhere. And the longer we were together, the more he would come home and say to me, I'm at these things and people are asking me questions about motivation. They're asking me questions about behavior change. They're talking about clients draining them and burning them out with their negative attitude. And I just keep saying to them, I feel like you should be asking my wife these questions. And so that kind of opened the door for me to come into the fitness space and to present on dealing with negative thinking, working with clients who say they have no motivation or they've lost motivation. And I use big fat air quotes around that because I don't really believe that's a thing. And then I really was welcomed in by many people in the fitness industry, give us more education. And what I found is coaches get good training on some of the X and O's of program design and biomechanics, but there really was very little training in the difficulties of dealing with human beings and all of the messiness and ambivalence and resistance that they bring. And that coaching is really a relationship, and how to manage that relationship has a lot to do with how successful you're going to be in your career, and maintaining a client load that's going to sustain your success.
I have a feeling the audience is going to get really mad because everything you just said confirmed all of my biases that I've ever had about coaching. I'm like, if there was one hill that I was willing to die on, it would be that the reason your clients can't get results is not because of your X's and O's knowledge. It's about your
Yeah,
ability to deal with human beings.
bingo.
And, everything that you're saying is so true, especially now that we are in this very weird space publicly, whether it's social media or the continuing education sphere, where everything is X's and O's focused.
Mm-hmm.
Um, and what struck me when I was listening to your background was that regardless of if you were dealing with an athlete or you were dealing with an executive, there are so many parallels across both when
Mm.
it comes to
Yes.
performance.
Yes.
And maybe you could speak a little bit on one of my theories when dealing with people is our biggest assets are often our biggest liabilities.
That's right.
So when it comes to high performance type A mindset,
Mhm.
that can get flipped on its head into the other direction with addictive behavior.
Correct. That's right. So I identify myself as a strength based therapist, which means I am leading with understanding what your superpowers are and how you have leveraged those in your life to get where you are, and then how to manage those so that you don't get overuse injuries. In other words, to translate into what you just said, sometimes our greatest strengths end up being the things that make us sick, that make us burn out, that push us away from balance and health and sustainability. And I see this over and over and over again, both with athletes and people who are very successful, in their careers that are not sports, which is, people who are persistent or diligent, people who are really hardworking. They
Mhm.
really made a difference for themselves in their teens and maybe their 20s by grinding harder than everyone else, putting in more time and dedication and pushing themselves. And then they achieve high heights. And as a professional athlete or as somebody at the top of your game, in corporate America, you cannot go without sleep night after night after night. You cannot go without relationships. You cannot go without paid time off and vacation. So, what I see is that once people reach a high level of achievement, they actually need to back off of their superpowers and work on other strengths that they have, work on other areas of their life. So, it's less coaching when I'm doing performance coaching or executive coaching with those kind of clients. It's less about pushing them and it's more about recovery and sustainability and avoiding overuse injuries that really get you into that burnout zone.
Well, I mean that mimics like if we use the parallel to my own journey here, I've experienced burnout on two different occasions. This is exactly
Mm,
what you said. It's like back in 2015, I actually quit coaching entirely
wow.
because I was working 100 hours a week at
Yep.
a college.
Yep.
Didn't have any personal connections. Didn't have
Hmm.
any time to myself.
Hmm.
Was running myself into the ground because I'm a hard worker.
Right.
That was my identity. And then again in 2000, I guess it was, 2019, 2020, it was, all the other stuff of my life was chaotic. So I leaned on training and work. And it just, you can't use that as a coping strategy. You're not sleeping, you're not eating. I had my
Mm,
first panic attack and,
mm,
here we are. But one thing that you really hit on is I didn't learn how to back off until I was, my back was against the wall.
mhm.
And I was lucky enough in both of those occasions to have amazing therapists in my corner to help me navigate those situations. So I'm like the biggest advocate for therapy. Um, I still go every month. My wife makes fun of me. She calls it my monthly mental toothbrushing.
Yes.
Just go in, brush my teeth, make sure I'm not going crazy, and then I go home.
Mhm. Thank you so much for sharing that. I think it's so powerful for listeners and everyone out there to understand what I'm talking about from the inside, like from, somebody they've been listening to and they know on a more
Yeah,
personal level.
absolutely. And one thing that I always come back to is motivate, like underlying motivations, not
Mm,
necessarily motivation in the sense of a drive to accomplish, but more so the motivations behind engaging the behaviors that you're engaging in. So
Mm-hmm.
an example that I give often is I give my wife flowers. So that's the outcome. Is the motivation that I give my wife flowers because I want to see her smile? Or am I giving her flowers because I'm sad and seeing her smile makes me happy? One is inherently benevolent, the other is inherently selfish, but it's the same outcome.
Mm-hmm.
What sorts of behaviors are you seeing with these high performers that maybe mimic and maybe how those underlying motivations come in, and how do you help them understand those?
Mm-hmm. I love that you've thought about these different buckets or qualities of motivation as being, the way that they're described according to the theory that I love, which is self-determination theory, is
Mhm.
different qualities of motivation. So you could be motivated to get a reward, like money, or to
Mhm.
avoid a punishment, like getting in trouble with the law for not paying your taxes. You could be motivated to do something because doing it will make you feel proud, or not doing it will make you feel guilty. You
Okay.
may engage in a behavior not because you like it, but because the outcome you achieve has personal value to you. Like, for example, somebody saying, I hate exercising, but I'm a grandparent and I want to run around in the backyard with my grandkids and I don't want to die of heart disease in my 50s like my father did. So I'm
Mhm.
going to do what I need to do. And then up there at the top, the highest quality motivation we have, especially for behaviors that are not intrinsically fun, like exercise and eating right, is that the behavior is integrated into your identity. So I'm
Right.
the kind of guy who gives flowers to my wife because when I do that, I see her feel joy,
Mhm.
and it helps her to know that I'm there with her. And because I'm a good husband, that's who I am. It's part of me. So there's these different levels of motivation that have a different quality. And the higher the quality, the more likely the behaviors are to stick. So, to come back to your initial question, when I'm meeting with people who are very high achieving and we're talking about motivation, often what leads them to burnout is they've lost some of the joy, the intrinsic motivation, and they've lost that, like, it makes me feel like I'm being me to work or to
Mhm.
play my sport. And actually, the focus has shifted too much onto money or onto not losing, or else I'll feel like a loser, or I'll feel embarrassed, or I'll feel ashamed. So the quality gets low, even though
Yeah.
they used to have a higher sense of motivation around the behavior.
Yeah, that resonates fully with me, knowing that when I was going through those periods of burnout, um, I wasn't necessarily engaging in the behaviors because I loved them anymore, or that it was part of my identity. Although I did identify very heavily as a coach,
Mm-hmm.
it was that I was avoiding self judgment by
Mm.
continuing to engage in those behaviors. So for me, my intrinsic motivation was avoiding self judgment.
Which is, so in according to self-determination theory, this is called introjected motivation. So
Okay.
you're doing something to avoid feeling guilty or shameful or bad, and or maybe to try to feel proud or accomplished.
Right.
Right. So it is a motivation. I have had past clients call it like Catholic motivation, avoiding feeling
Like
guilty
the
or
guilt. Yeah.
embarrassed, right? But it's called introjected because it's not really all the way internal. It's kind of bound by social
Yeah.
demands, norms, like shoulds, quote unquote, that we put on ourselves. So you're describing trying to avoid feeling bad,
Hmm.
um, and continuing with the behavior to feel like, okay, now I'm doing what I should be doing, maybe.
Yeah. And I think, I'm sure well, I know for a fact, a lot of our clients deal with that because there are expectations placed upon them by the world.
Oh,
But
yeah.
one of the things that I found most fascinating about myself, and a lot of the clients because I have this level of awareness now over myself, I'm able to empathize with the clients that I work with
Hmm.
and identify those sorts of behaviors in them and those different motivations in them, is that they're not necessarily, they say that they're motivated by some external standard or external expectation, but that external expectation is inferred by their own bias.
Correct. Hmm.
I find that, and especially with high achievers, it's like, oh, everyone expects me to be this way. Yet no one has ever explicitly said that there was that expectation there.
Mhm. Mhm. But they've integrated it. They've
Yep.
internalized it. Basically, they drank the Kool-Aid and now the Kool-Aid is in their veins
Yep.
and they're internalizing those own shoulds onto themselves.
It's so fascinating. What are some of the ways that like you work with people to, obviously, if we're using some element of cognitive behavioral therapy, there has to be an awareness and identification of those behaviors. What
Mhm.
are the strategies that you would implement to kind of break them out of those limiting beliefs?
Yeah. Well, thanks for throwing CBT out there. That is
No problem.
a much loved style of therapy, particularly for people who are educated and well read. They like thinking about their thinking because it
Hmm.
gives them somewhere to stick the crowbar, somewhere,
Yeah.
something they're good at thinking about their thinking. I live in Boston where there are many, many universities and many, many hospitals and many, many highly educated people. So they love CBT. Um, what I love in addition to CBT is getting people to access and process some emotion as well. Because I
Okay.
think as a society, we're much less good at that and we get much less practice at that. So I take an eclectic approach. And again, my in is always strengths.
Hmm.
So when I'm hearing about what someone does well, I often am hearing about how they have used their thinking to push themselves to achieve high heights. I usually name that pretty early on. And when you name a strength that somebody has, immediately what they do is start telling you about their shortcomings or their weaknesses or where what they're trying to cover up or prevent.
Hmm.
And so what happens is the more that you reflect what someone's strengths are and what they're doing well, the more they widen that lens and give you the whole field of what's good and what's not good, what
Yeah.
they lean into and what they're leaning away from, what they're resisting and what they're pushing towards. And I'm always listening for that polarity. On the one hand, I want to achieve and make lots of money. On the other hand, working towards that makes me feel miserable and I kind of just want to hang out with my family.
Yeah.
So I'm always listening to, can they start to name that conflict, that polarity? And can we start pulling apart what those different feelings are and where they're coming from?
People are so. One of my friends, Bill, phenomenal story. This gentleman, but he has a quote. He's like, "People are going to do people things," and until we realize that people are these very complex, multifactorial thought engines, we can't really dive into helping them fix themselves. Because ultimately, like, we as coaches, we're not problem solvers; we're solution finders because the problems have to be solved internally. Um, I would love, like, this is a perfect segue into the conversation that I was very excited to talk to you about is coaches who internalize their clients' problems and have an inability to hold space.
Hmm.
Can you talk to me a little bit about what you see in that regard with coaches, especially in the fitness field?
Yeah. Well, even the fact that you're asking that question says to me that you listen to coaches when they talk about what
Oh, of
really are the
course.
things that burn them out and bother them, and that it has nothing to do with program design.
No.
What you are describing there is actually the topic of the volume 2 of the continuing education course that I just released, because these are the things that coaches ask about behind closed doors or in seminars or consultations. And it is about the way in which coaches are typically bringing very positive intention to help, to find solutions, to quote unquote fix things. And it's not their fault. That's the way it's presented to all of us when we're young. Like, we want to help people and be a doctor or be a lawyer or be a coach or be a therapist. All of us go in with that. And then we go to school and school says, okay, give this program or give this treatment protocol, tell your clients what to do, and then they will do it and then they will be fixed. Right? Then we get our certificates, we go into the
Yeah.
field, and nobody does a damn thing that we tell them to do.
No,
And then we get frustrated, we absorb their feelings, we start to question our own abilities and intelligence because they're not doing the shit we told them to do.
absolutely.
So there's a whole lie that gets told at the get-go, which I wish we could just get out there, which is that if everybody just did what they were supposed to do, there would be no fitness industry, there would be no field of psychology, there would be no financial advisors. Everybody
Right.
would just read the article and execute what they're supposed to do.
Yeah.
And so when you go in as someone who feels that you have the solutions, you have the knowledge, you want to help, you open that space, your client has ambivalence. On the one hand, they want to change. On the other hand, they don't want to change at all. So they'll
Hmm.
give you their money and say, help me lose 10 pounds. And then they'll sit on the couch and eat Oreos and say, oops,
I'm not losing weight, coach.
I'm not losing weight, coach. I don't know what's going on. I'm doing what you're saying. And so that is not under the control of the coach. It is
Hmm.
under the control of the client because the client has all the control. But we're under the belief like, hey, if we just coach up correctly, we will make this person change. And that's the paradox in people helping relationships. Even though you have knowledge and authority, you are powerless to make the other person change.
Okay, I'm going to push back because one of the ways that I actually help myself deal with these sorts of situations
Uh-huh.
is applying some extreme ownership. So if a client is having trouble with adherence, or if a client is having trouble executing the plan,
Mm,
whether or not number one, I choose to believe that they have the best intentions. So they're not trying to suck.
right.
Okay. If they've given me the money, they probably have some underlying motivation that is, and I want to take ownership over finding that.
Mm-hmm.
So I take that extreme ownership approach of like, okay, the client isn't able to follow the plan. It's my fault. How do I move forward? And I return back to solution finding.
Mm-hmm.
But that only happens through relationship building
Mm-hmm.
and conversations with that client about what it is that they're actually willing to do. Because in a
Mm-hmm.
lot of instances, I find coaches will jump in whole hog with this massive intervention when really the client needs one or two things.
Mm-hmm.
And so now the client isn't able to adhere. Let's pull back the layers. Let's rely on that relationship building strategy and let's try to meet them where they are. And here's where the ownership for me takes hold is I can only help to the level of skill that I have. And if I don't have the skill set to help a client find that adherence, then it's my responsibility to take control and to refer out, perhaps to someone like yourself.
Mm-hmm.
If I can look in the mirror and tell myself, I did everything I know to help this person, then for me, there is no guilt, there is no shame, there are no negative feelings.
Mm-hmm.
But I've also been coaching for 20 years. So that level of awareness and agency I have of the process has been developed over time. I've learned it. But a lot of coaches do exactly what you said. They're like, oh, client won't adhere. I'm doing my best. I'm shit. Everything sucks. Or even worse is, oh, this client sucks.
Mm-hmm. Yeah. And I wanted to underscore what you said when you talked about taking ownership
Mm-hmm.
is recognizing, okay, the plan's not working.
Mm-hmm.
What can I do to meet the client where they're at?
Yep.
Right. So you could have all of the knowledge and all of the skill in the world, but if you do not meet the client where they are at, you are completely ineffective. So, yes, you can take ownership over the coaching and yourself. And you can do that by meeting them where they're at, which is that client centered model. Because the
Mm-hmm.
skills and the interventions have to meet the level of willingness and readiness where the client is. And so that part of your description, I think, makes a lot of sense in terms of what are the things that you have power and control over as the coach.
Right.
You
And I
can
hold to
control,
those. I hold to those
right,
as much as I can. Yeah,
right.
for sure.
Yeah. And I think, I'm hearing you and I'm thinking you're probably a coach who really cares. And it probably felt super crappy to see clients not making progress and you feeling like you didn't know what to do, or maybe it was your fault.
Yeah, for sure in the past. But at this point, the number of people that have crossed my desk, I'm also very aware of, their stages of readiness for change,
Mm-hmm.
right? A lot of them have not been that call to action just hasn't been there. Right? They haven't had some sort of life-changing event that has prompted them to create change. They just have this like voice in the back of their head that maybe they should do something different.
Mm-hmm.
So part of that ownership over the process is maybe I can help them uncover that call to action.
Mm-hmm.
Maybe I can help them realize that, hey, these behaviors are not actually leading you in the trajectory that you want to go. Let's look at why you're engaging in these behaviors. A client
Mm-hmm.
that comes to mind, I think case studies are a great example, for the listeners too. It's like
Yes.
a client that comes to mind. She's been dealing with disordered eating habits for 40 plus years. She's 53 years old.
Mm-hmm.
She competed in dance and then was in the fitness industry as a
Mm-hmm.
fitness model. That those behaviors are not going to be fixed overnight. Nor do I actually believe that they will be fixed, but they can be managed. But her coping strategy is skipping steps and looking for easy ways out because she doesn't
Yep.
want to and her reasoning is, I don't want to disappoint people. So for me, the conversation isn't about, okay, what macros do you need to eat? It's not about what portion sizes you need to do or how much exercise. Because actually, with this client, her lower back injury is so bad she cannot exercise.
Mm-hmm.
So she is looking for control. She's looking for the thing. She's looking for the GLP-1 or the back
Mm-hmm.
surgery or the therapeutic injection.
Mm-hmm.
But what's really going to help her is identifying why she's looking to those things and not actually following the rehab plan that she paid $3,000 to go see Stuart McGill to have him put together.
Mm-hmm.
So to me, like that's the art of coaching, and that's the people part of coaching that is often missed. I could look at myself and say, oh, this client isn't following her nutrition plan and I'm a terrible coach. But that would simply be untrue.
Right. And you mentioned, knowing the person's not ready to change, but there's a little voice, this is
Mm-hmm.
the trans theoretical model of stages of change. That's the contemplation stage. And when
Yep.
somebody's in contemplation stage, what do they need? They need to explore. They need more education, information, right? It's not time to tell them macros. It's time to get curious about that little voice. And I wonder where that little voice comes from and why that little voice might want you to change, and to help grow that little voice into a bigger, more clear voice that then starts to feel like a desire for action, like you said.
Yep. But if, and I think the issue is that if all you have is a hammer, everything is a nail.
Mm-hmm.
And I think the only tool that a lot of coaches have equipped themselves with is calories, carbs, fats, proteins. Talk to me a little bit about how nutrition, and this is a theory, and I'm sure you'll play off of this, is like if I want to get a window into someone's mental health, like if a client's mental health,
Mm,
I take their food away.
mm.
Like you want to know somebody's deep-seated insecurities, dark thoughts, make them hungry.
Sounds like torture.
Well, like you put someone could be in a phenomenal mental headspace. Everything's all hunky dory. They say, "Hey, I want to go into a cut," and all of a sudden, the demons come crawling out.
Mm-hmm. Yeah. Caloric deficit, right? Is
Yeah,
what you're talking about.
yeah.
Yeah.
So, talk to me a little bit about how nutrition can be that link between mental health or any of these underlying things that might be going on.
Mm-hmm. Well, the relationship with food is so complex. It's so much more than obtaining satiety and adequate nutrition. Food is escape, food is love, food is culture, food is religion, food is philosophy. There is so much belief and ritual wrapped up in food and in eating. And the way
Mm-hmm.
I found myself into the eating and the eating disordered space is really via addiction. In my
It makes
early
sense.
years, yeah, working with people in recovery, it was fascinating to hear people who had like bypass surgery and never had a history of addiction. And then in their 40s or their 50s developed heroin addiction or fentanyl addiction or alcoholism. And I'll never forget this man sitting I used to run like an intensive outpatient program. So like the 2 weeks after detox, it's like
Okay.
2 weeks worth of group. And I remember this man saying he had been something like 400 pounds and had bypass surgery. And he said,
Holy
I
shit.
wasn't addicted to food. I didn't have a food problem. I just ate too much. And there he was 6 or 7 years later, because he had been like eating his fentanyl patches and was fully full blown opiate dependence.
Oh
And
man.
I heard a handful of those stories, like, wow. And then when I went into outpatient and people who had longer sobriety, they started talking about doing behaviors with their eating that was like when they were drinking or when they were using, that they would be sneak eating, or that they would be lying about what they ate, or that they would feel shame after they ate something that made them feel really awesome, or that they would start fantasizing about binging on something during a really stressful day or moment in their life. Um, and then people in recovery started to name to me, like, I think I have a food addiction, or I think food was my original addiction before I started, before I started whatever the drug of choice was. And then when I started working with athletes and in fitness, then I started to see this other presentation of people like your client who had been fitness competitors or runners, or particularly female athletes, who had been socialized to basically live in a relative energy deficiency,
Hmm.
and thought that was good. Actually, thought that was like a high status thing to achieve, to be underweight and underfed, and achieving at a high level. So that relationship can also present a lot like addiction.
Now, is it
And
like a dopamine seeking
it's
behavior?
a good question. I mean, I think you probably know this. There is controversy out there in the world about whether or not food is an addiction. And I think from a neuroscience point of view, I'm not in a position to make that kind of conclusion, but I can say, as a psychotherapist, it walks like a duck and it talks like a duck and it sounds like a duck. So if you ask me, addiction is continued use despite adverse consequences.
Right.
Addiction is mental preoccupation and relationship with something other than a person to help you manage your internal life. And people do that with food. So call it what you will, but I see it a lot.
And to me, it makes total sense. And, whether, okay, I'm going to say something that I think is going to ruffle a few people's feathers, but if you achieve anything in fitness or anything in general at a high level, I think you have an addiction of some kind, right? We can't, high performance is not healthy. It's not healthy
Correct.
it's not healthy physically, and it is not healthy mentally.
Correct.
And this is coming from somebody who's, I've been top 10 all time in multiple weight classes in powerlifting. I've competed in bodybuilding. I've,
Hmm.
played college basketball, and at no point were any of those things healthy.
Hmm. I really like that point you're making. That's basically my avatar in my practice. There's a difference between mental health counseling and performance enhancement coaching. I think for me, the challenge is how to thread that needle. How can you pursue the goals you want and achieve the highest level of physical and mental health? Because those two things, like you said, don't complement one another. But how can you work towards getting the best you can get for yourself while at the same time managing your health?
Do you think that's possible?
I think that there are no solutions, but that there are trade-offs. And I think
Oh, you're speaking my
as you,
language.
as you gain achievement, you gain expertise. So,
Hmm.
for example, I just put a course together. I was way more efficient writing the copy, getting everything loaded, getting all the content together than I was 10 years ago,
Hmm.
as I have a lot of reps in the tank. So when I'm talking to somebody who has been busting their ass for 15, 20 years to get where they are, I say, you don't have to bust your ass the same way you did when you were coming up, because
Yep.
now you can be more efficient with the muscles you have built and the skills that you have on board. And how do we leverage that so that you can work less hard and still achieve?
That is probably going to be the hardest thing ever for a type A person to adhere to.
But usually they're coming to see me because some
Yeah.
kind of consequences are at play. Like, nobody comes to
Right.
see me because everything's hunky dory. Like, something's going on with a relationship, or they don't like the way things are going with their drinking, or they know that something's got to give. And so when I lead
Mm.
with strengths and superpowers and achievement, it helps to think about, I've met many a person where I say, do you think you need to work as hard now as you did when you were 22 and you were in law school? And they'll say,
Yeah.
no, back then I didn't know what the hell I was doing. Okay.
Right.
So, how can we leverage that to help you take your foot off the gas, even like 5%?
Yeah, I'm not so sure that you can, like you said, the word you used is perfect, trade-offs, right? So as you push towards higher and higher levels of performance, there are inherent trade-offs that come along with that, whether that be to health or to social life or
Mm-hmm.
to lifestyle.
Mm-hmm.
And there are some people who are willing to make those trade-offs, but I don't think everyone is willing to make those trade-offs for their entire lives. The other thing that I think changes is as you age, those trade-offs become larger and larger.
Hmm.
And I think your priorities get split a lot more as your life expands.
You got it.
And I would also make the argument that your willingness to engage in those trade-offs to the more negative perspective, well, I won't say the word negative, to the more severe perspective, I think your reasoning or motivation behind your choice in that moment is probably a large driver. So you see these people making massive trade. Use an example like a professional bodybuilder. He's over 40. He's still engaging in performance enhancing drugs, still competing at a very high level,
Mm-hmm.
but he's probably making that trade off because he doesn't think that he can make a living if he stops competing. Do you think many people actually go through the trouble of that triage process?
Of trying to figure out what the choice point is there, or the pros
So
and cons.
not only the choice points, the choice points, but also why they're choosing to make those choices.
That's one of the joys of being a psychotherapist, is to help people unblend all that crap and tease it
Mm-hmm.
apart so that they feel like they can make an active choice. Because that guy that you're referring to, that case, he could make the active choice to go ahead and grind himself down until he can't do it anymore, and he's earned as much money as he could possibly earn doing that. Or he might pull it all apart and say, F it, it's not worth it, and I want to be able to walk or jog or whatever when I'm in my 50s. I don't know. But to give people the opportunity to make an active choice with agency, I think agency is one of the definitions of mental health.
Okay, again, great word. Because I think most people lack agency and they're kind of living in the moment, so to speak, and they're making the choice that is the choice they've always made.
Or that they feel they should make,
Yeah.
right,
So
according to some imaginary rules that they saw on Instagram or
yeah,
whatever.
I spoke about it with a friend of mine yesterday. He was talking about path dependency. It's like you choose the choice that you've always done because it's always gotten you to where you want to be.
Hmm.
But at some point, those trade-offs and those decisions don't actually have the same outcomes because
Mm.
of a multitude of factors.
Hmm.
Um, and I think the last place you want to be, if you're that 40 plus year old bodybuilder, is on dialysis. But do you even know that you're headed towards dialysis because you're willfully blind and you're not doing your blood work and
Mm.
all this other stuff?
Hmm.
So to me, it comes down to actually pressing pause and taking the time to think about it,
Hmm.
which was therapy for me. Like that's what
Right.
that taught me how to do that.
Right.
Um, yeah, I find this stuff incredibly fascinating, especially in the world of high performance. And I think where I see it the most now that I'm working with coaches, is they'll say, I want to scale my business. I'm like, cool. Here's how to do that. Okay, but I don't want to work that hard. I'm like, okay. 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 So you're going to have to make a decision as to how far you want to scale, because as you scale business, you scale workload and you scale stress and you scale pressure.
Hmm.
You also scale leverage. And they're like, okay, well, how big can I build it? And I was like, well, that's going to depend on you. And so that forces them to introspect and
Hmm.
realize, like, hey, maybe you don't want to be making $50,000 a month, because what's going to come along with $50,000 a month of earnings is $50,000
Exactly.
a month of service delivery.
Right.
And I don't
That's right.
think I think it's just really interesting. And when you bring in together that's all you've ever known, like your lawyers or your executives, all they've ever known is the grind. How do you convince them to back off?
Hmm.
Do you have to show
Well,
evidence?
they come with ambivalence because they're coming to
Okay.
therapy. So, there's always that, like, you're always listening for what's the rub. Yeah, they want more money. Yeah, they want to scale. Yeah, they want to be. I worked with this sales guy who just felt like he had to be the number one sales every single month. And he was killing himself to do this month after month after month. And I was like, well, what do you get out of that? And then what happens if you don't get that? What's your fear around? So I'm just
Yeah.
listening for both sides, and I'm listening to the pros and cons, and then I'll reflect the pros and cons. So on one hand, everybody still knows you're the best and you have that feeling like you're doing everything you can do. On the other hand, you're exhausted and the third woman has just broken up with you, and you
Mm.
keep ripping lines of cocaine every weekend because you feel like such garbage.
That's
Ah,
definitely not going to make him feel any better. That's for
so I
sure.
don't judge it. I don't judge it. I just name them both. I say,
Right.
on the one hand, this, on the other hand, that. Ugh. And I just hold it. I'm not making the choice for them. I'm not
Yeah.
telling them one side's better than the other. I'm just saying, on the one hand, this, on the one hand, that. And I'm pausing. And then when you pause, what the other person does is go, yeah, but really that side, that's bullshit. And excuse me, I don't know if I'm allowed to swear on this.
You can swear all you want.
And the other side, so what will happen is, if you don't judge, if you don't take it over and you don't make the choice and you leave it hanging,
Yep.
because ambivalence, nobody likes that. That's like being in a plank. The other person will lean in the direction that might be that little voice in the back of their head.
Right.
Yeah, but I don't need to eat a sleeve of Oreos every single weekend, or I don't need to drink 4 margaritas every single time I'm out with my girlfriends, or I don't need to be the number one salesperson every single month for 16 months. Nothing's going to happen. So what's my problem that I'm okay, that's a good question. I wonder what's making you feel like, right? And then it just opens the door with their own agency. They have asked themselves that question.
I love that. So, you use the word ambivalence, and when the way that you framed it was ambivalence is them cracking the door. So now you're having this conversation in the cracked door. And your goal as a therapist is to identify something that allows them to open the door and invite you in. And as soon as that happens, now we can start to create some
And
change.
you're getting somewhere. So what I say to coaches is, you would never, if your client needed to do 10 reps of, I don't know, a press, you would not stick your hands under their elbows and help them with every single press. No, you
Right.
want them to resist time under tension so that
Mm-hmm.
they can get stronger. And if they're in a plank and they start shaking, you don't think, oh no, I got to hold them up. You think, yeah, now they're going to get stronger because of that time under tension. Of course, it's uncomfortable, right? But as coaches, we know physically, ooh, we want that. We want to see them meet that resistance. And the same thing is true psychologically speaking. If your client is really struggling with whether or not it's a good idea to do something really stupid diet wise versus stick with the plan you have, it's not up to you to say, well, that sounds really stupid. It's up to you to be like, so I hear on the one hand, there's like, keep going with the program we're working on. On the other hand, maybe like Whole30 keto intermittent fasting month. Hmm. And I'm just coming up with like the most ridiculous proposal, because clients do this, right? Like, they get impatient. They want to come out of the plank. They want to
Mm-hmm.
come out of time under tension. And like you said with your other client, find a quick solution,
Yep.
right? And I mean, I wish there was a easy, quick solution. Like, wouldn't it be nice if your client could
Wouldn't
get
it
a
be
shot
nice?
and it will all be better? That would be awesome. And I really feel for her that there's no shot, but there's no shot.
There's no shot. There's just work.
There's
There's
just work.
um, I'd love to have a conversation around I call it cognitive consistency. You could also like some element of cognitive dissonance, where people are willing to buy a red light therapy machine, but aren't willing to get 8 hours of sleep.
Yeah.
Where does that come from,
Well,
Lisa?
wouldn't it be nice if you could just sit in front of a light and then
I
you wouldn't
know.
have to go to bed? I
I've got
mean,
my I've got my happy light here, which is, for those listening, it's like a vitamin D light. And the only reason I have it is because I live in Canada and it's dark most of the day. But
mhm.
like, you get you get people, oh, I don't really want to eat healthy or anything, so I'm just going to take a GLP-1 and I'm just going to lose weight. It's like, what are we really after here? What are like is that something that you see often in your practice of, searching for the easy way out, or maybe not having intellectual consistency between different opinions?
Well, I think it is human nature to look for the most efficient way to solve a problem, you know?
Okay.
So, I come from a place of respect for that. Like, I have taught spinning, indoor cycling for almost 20 years now. And what I tell people in the class is your body wants you to work in a moderate, efficient, zone two, zone three state. It does not want you to push really hard in a max out interval because it will be expensive for your
Yeah.
system. But what you want to do is full throttle, and on and on and on. I let that metaphor rip. My point is, I think that as human beings, we're always trying to think about how can we maximize pleasure and minimize discomfort? How can we get the most, that we want with sacrificing the least? And so when I think about that as part of human nature, the natural question that comes up is like, how's that working for you? And like, if eating like shit and taking GLP-1s works for you, mazel tov. Like, I, I'm happy for you, but they're probably not talking to me because it's all going great. And in fact, a lot of people say to me, even people who I think are candidates for GLP-1s, that they feel shame or guilt or like they're a failure or they can't do it on their own if they take a GLP-1.
Right.
So I tend to see more here. I tend to hear that a
Yeah.
lot from people and really questioning like what's wrong with my character, what's wrong with me morally, what's wrong with me as a human being that I can't lose weight. It must be a character defect. It must be that I'm a loser or I'm
Right.
stupid, or there's shame wrapped up in that a lot.
Yeah. And I think too, the bring it back to trade-offs. It's like, I could do this on my own, but it's going to involve a lot of hard work and it's going to involve a lot of behavioral change and a lot of introspection. Or I could take this injection once a week and tolerate side effects. And for all intents and purposes, you will lose weight on a GLP-1. Uh, the other example is, I don't eat out of plastic and I don't heat my meals in a microwave because I'm afraid of the chemicals.
Hmm.
But I'm going to go drink on the weekend. I see that all the time.
Yeah. Beliefs, man, they run amok. And
They do.
if you always are trying to meet the client where they're at, you don't
Mhm.
have to worry about having all the answers. If you can approach things with curiosity, you bring your little toolkit, right, of the knowledge you have and the skills you have, and you meet them where you're at. And then how's that working for you? And what are the pros and cons? You're going to hear, I don't like this, or that's not working for me, or there's consequence. You're going to start to hear them. That agency can start to bud, and then you have got somewhere to stick the crowbar and you've got something to anchor into.
A common thread in our discussion that I'm coming to realize is that in your therapy sessions, you don't talk very much. You ask a lot of questions and you listen. I think the more young coaches that I speak to, it seems to be a challenge.
Mm,
I always will preach, like, in sales calls or in consultations, you should be talking less than 30% of the time.
mm. It's hard.
It's very hard.
It's hard,
And
right? Especially you got energy, you got knowledge, you got enthusiasm, of course. And I want to share with you, Paul, that it's not easy for me to not talk a lot. I'm very verbal and energetic, as you probably can see. And so I
yeah.
have this post it note stuck to my computer, and it says WAIT. And WAIT is an acronym that means why am I talking?
Oh,
Because
love
as
that.
the coaches, we need to shut the F up a lot and listen way more, like you said, 70-30, So I keep that right there on my monitor to remind myself, yeah, you probably got ideas, you probably got insights. Shut it up and wait and listen and hear about where is the change talk, where is, wait for that little voice to come out, wait for the hints that the client has an idea of what they want to do or where the low hanging fruit might be or what's not working for them. And wait till you're like, okay, when it's my turn to talk, I'm going to knock them dead with my big, fat, juicy insight because I've been
Right.
listening and accumulating good data.
Yeah, I totally agree. And I want to highlight too, like there's a difference between listening to respond versus listening to hear and
Mm-hmm.
understand somebody.
Mm-hmm.
And I think with all that enthusiasm and knowledge, you want to respond and you
Mm-hmm.
want to solve the problem,
Totally.
but that's not your job.
Yeah.
It's
It's a
not your
kind of
job.
like bad news, right? To those of us who are, because
Yeah.
I totally came into this profession like, oh, I'm going to help people, I'm going to fix people. And so, yeah, it's kind of bad news that no, that's not what's going to be most effective. And you don't have all the answers.
What do you think is the best way that a coach can improve their soft skills?
Mm-hmm. I really think education in this area, expose yourself to really good information. So I think motivational interviewing is a solid foundation of how to communicate with your clients and using things that we've talked about today, like meeting the client where they're at. Client centered is motivational interviewing 101,
Yep.
and listening a lot and meeting and hearing their goals, fleshing those goals out, and introducing intervention or suggestion very sparsely. So the theoretical stages of change, you talked about that today. I think that is very important for people helping people to understand. We also talked about motivation, self-determination theory. I really feel is a very effective way to think about motivation. Paul, it says you're offline. Did I lose you? Understanding the client, and then it's also important for you to know yourself. What are the
Hmm.
biases that you come with? What are your strengths? What are your blind spots? What are things that maybe trigger you or get you talking too much or trying to take over or taking on the client's feelings, and what really helps you to shine as a coach and bring your best? So knowing thyself and then understanding human nature, I think those are the core elements.
Do you think that coaches need to go to therapy?
I think everybody needs to go to therapy, but I'm the most biased person that there is. um, Freud famously said, if you have a best friend, you don't need psychoanalysis. And what he meant by that is if you have somebody in your life that you can examine your thoughts and your feelings honestly and openly and get some reflection,
Mm,
that's really what the talking cure is, right? Is having that space. The benefit of a therapist is, you don't have to worry about reciprocity. You pay for your time. So you're not going to have to listen to them talk about their problems for an equal amount of time that you share about yours or whatever, the unspoken rules are in your friendships. Um, so I highly recommend it. I think it is a wonderful investment in your time and in yourself and in your business, in your
I
career.
totally agree.
Yeah.
Yeah, I echo your sentiment. I think everyone needs to go to therapy. Knowing yourself on a level where you have someone who is a neutral third party, you don't have any attachment to that person, and they can just reflect on you and show you the parts of you that you might be blind to. I think is incredibly insightful. On the subject of continuing education, you mentioned that you put together a course. What's the course? Who is it for?
Yeah, thanks for asking. So my courses are called Psych Skills for Fit Pros,
Okay.
and I just launched Volume 2. So Volume 1 of Psych Skills for Fit Pros is about your clients. It's called Motivate and Facilitate Change. And there are three core parts of the course, which are motivation, the stages of change, and motivational interviewing, because I think those are the foundational, you know, parts of coaching.
Mhm.
Volume 2 is called Inside the Coach's Mind. And all of that content The ideas for all that content came from consultations, presentations, podcasts, work that I've done with coaches. So it is about a lot of what we've been talking about today, know thyself. And my coming to see that coaches don't get any support or education in working with themselves and knowing themselves. So that curriculum includes boundaries. How do you set limits professionally and personally to avoid burnout and take care of yourself? It includes your cognition. So what's your thinking style? What's your expectation style? Are you optimistic, pessimistic? How does that influence your decision making? What's your explanatory style? So how do you explain the reasons why people do the things they do or why things happen in life? And then how to work with that, because the beauty of CBT is you can always work with your thinking. You can
Right.
always improve it. And then I do a whole module on emotions, reviewing updated neuroscience on what emotions actually are and what they're not, and how your emotional stuff comes up in your work with your clients. How your clients' emotions, sometimes you take on, sometimes you're projecting crap into your sessions. There's a whole dynamic going on under the surface of X's and O's and reps and sets. And if you're aware of that, what you're bringing in and sometimes what people are giving off, it can help you to let go of stuff that has nothing to do with you, to take care of yourself when you're hungry, angry, lonely, tired, drained, and to manage that dynamic between you and all kinds of different clients who are coming at you with all kinds of baggage. you know.
I friggin' love that. I'll have links to where everyone can buy these courses. I
Thank
think,
you.
listen, I said at the beginning, I think having soft skills, the ability to read people, the ability to speak and listen is what's going to make the biggest impact on your clients. It's not what you know about physiology. It's not what you know about the X's and O's. It's what you know
Amen,
about
Paul.
people.
Yeah.
Yeah,
That's
for
what
sure.
coach after coach after coach tells me. Not fresh out of school. Yeah, but when people gain experience and they're working, they're like, you know what? What I do that is effective has very little to do with the stuff I learned to get my certificate.
100%.
Mhm.
This is a question I ask all the guests on the podcast. If there was a billboard on the side of the highway and you could have one message that everyone would read, what would it be?
It's a Winston Churchill quote. Never, ever,
Okay.
ever, 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 ever give up. You're a work in progress, and you can always work on yourself and move yourself forward.
I love that. Lisa, thank you so much for joining me today. I do have one final question. If there was one person that you would like to see me interview on the podcast, who would it be?
Ooh.
The caveat is that you have to help me get them on.
I love Candace Smith, Beauty of Strength. You know her?
I don't know, but I would
Yeah,
love to meet her.
I actually interviewed her in my most recent course. Um, Candace, Candace Smith,
Okay. Okay.
and her website, her tag is Beauty of Strength, and she does nutrition coaching and strength training. And I have a lot of respect for her. I think she'd be fun for you to talk to.
Perfect. I'll have a look. Lisa, thank you so much for joining me.
Wow, my
Everyone,
pleasure.
thank you for listening. Please make sure to like, share, subscribe, and ring the bell for notifications. And we'll catch you on the next one.